Dr. Reckman, I love this question. I know you do a lot of work in this space. It's all about AI and using digital platforms to kind of help what we're doing for our patients. Is it helping right now? Are you using AI to shorten the time it takes for you to evaluate an individual situation? Is it helping with medical decision making? Is it making some of these complexities and nuances and gray zones in thoracic oncology more accessible, easy to digest by providers?
For providers, maybe. For me, it really helps insert emotional intelligence into my communication with colleagues and sometimes for patient messages. It helps me with peer review or with rebuttals when I get denied by insurance. It saves a lot of time. Actually, made the New York Times. It's an article called 35 Ways Real People Are Using AI Right Now. What used to take me over an hour takes, like a minute or two to write rebuttal letters for insurance companies. But so I wrote this digital textbook that's used by about 3,000 people all around the world every month. It's just radonc.org. It's critical critique of commentary on clinical trials. And I've tried to feed it into like Grok and ChatGPT. And the reality is, it doesn't understand the nuance when it comes to, cancer care. I mean, it gets a lot of things right, like the emotional component of care for patients. I think it's a fantastic thing to do to help come up with sets of questions to ask your oncologist, for example. But when it comes to treatment, it still kind of misses the mark. A lot of times I say that we're trying to, fit the camel through the eye of the needle, so to speak, with these really nuanced discussions we're having today. So it does require like expert oversight to see what they're recommending because there's a lot of gobbledygook. Even with the references, for example, it'll make up papers. So yes, I think it's a powerful tool, but also I'd like to train it, like to give better answers. But I've tried to train it and it still misses the nuance. Like I've fed thousands of pages and references into it, and then I ask it very specific questions and I give it an F. So it's largely helpful, but we should have a raised eyebrow.